Welcome. Thanks very much for joining me. Where's the big opportunity that you see now for innovation in public sector, federal government, health IT delivery?
Yeah, great question. At Unite Us, the biggest opportunity that we see is around a more robust infrastructure that connects the whole healthcare ecosystem. The biggest challenge today, I would say, is both on the clinical and non-clinical side of the house. It's very fragmented, it's very siloed, it's very regionalized. And so, for Unite Us, there's major opportunity to kind of modernize and, provide, I guess, a glue that connects providers, connects the government, and connects healthcare, right? As well as CBOs, community-based organizations. The driver behind all that is our new era of government, right? And a perfect example of that is, what were the first contracts that were scrutinized in the past 3 months? All around the NGOs, right? Where's the money going? Is it justified spend? And it's no longer efficient enough to, provide money just for operating cost. Every dollar requires accountability, and that's what Unite Us brings in spades. And we accomplish that through our national closed-loop referral network. We've established community-based organizations. Think about local food pantries, local shelters, transportation services, legal services, across every community, across every state, across the entire country. And what our tool allows you to do is that we'll screen you for social care needs. And based on your social care need, we're able to refer that need out to our national network. So based on your geographical location, it gets picked up and it gets serviced. But because it's a closed loop, what that does is that provides a measurable, structured outcome. And so, it's a huge shift as far as making every dollar accountable in the relation of social care. And for us, we don't think anyone in the marketplace is positioned better than Unite Us to capitalize on that. And specifically for military health, we understand things like food, childcare, mental and behavioral health services. They play a major critical role in both readiness and retention within the military itself. And so for readiness, the main goal, for any commander and their troops is to maintain your status as a deployable asset, right? And if you have trouble on the home front with things like basic needs like food, providing transportation or childcare, that can really impact their ability to go and be a warfighter. On the retention side as well, it's not enough to just be able to provide basic support and services. We want to create an infrastructure that is going to allow families to prosper, right? Programs that allow them to kind of have a stepping stone to get ahead. So with a more modernized infrastructure that can provide those services, right, we see a major impact on both driving readiness and retention for our military. And again, the beauty of Unite Us is we have an extremely accountable delivery service platform. And based on that closed loop referral, based on meeting all needs, we're able to empower our defense, our forces, our branches of the military to both be strengthened around readiness and retention.
It's great to have you here. Thanks very much for joining me.
Thanks for your time, Francis. Appreciate it.